Hi, this is Heather Zylstra. I will be presenting about the growth hormone today for chemistry. If my screen will work. Here we go. So for growth hormone, it is made of 39 carbons, 60 hydrogen, 8 nitrogen, 13 oxygen. Growth hormone is also known as GH or somatotropin. The molecular mass is 22,124 Daltons. The picture on the right is a simplistic version of what the GH molecule looks like. There are 4 helixes in structure necessary for interaction with growth hormone receptors. It shares similar structural features to prolactin and somatomamotropin. Let's try that again. Somatomamotropin. And it consists of 191 amino acid residues, polypeptide chains with 2 disulfide bonds. GH activates receptors in cell membranes in order to have successful binding. There is a hydrophobic interior on the membrane and a hydrophobic patch on the exterior of GH. It has a short half-life of 10 to 20 minutes. The function of growth hormone. The growth hormone is responsible for many functions, actually, inside of the body that most people don't realize. It's responsible for growth of all organs except for the brain. It increases muscle mass through sarcomere hypertrophy, reduces uptake of glucose in the liver, promotes gluconeogenesis, which is the generation of glucose from sources other than carbs. It stimulates the immune system, increases calcium retention, which strengthens and increases mineralization of bone. It also promotes lipolysis, increases protein synthesis, and helps maintain homeostasis. So, growth hormone is produced in growth stimulating somatotropin cells in the pituitary gland. The pituitary gland is at the base of the brain, shown on this picture to the left. It is synthesized by anterior pituitary cells called somatotrophs. If a person is fasting or experiencing another catabolic state, GH will stimulate the release of free fatty acids. This will alter the glucose and protein, then further will affect glycogen source. And here are normal lab values, which the slide is very basic because I wanted to show kind of the contrast. So for men, ages 0 to 10, it's 0.09 to 6.29 nanograms per milliliter. 11 to 17 for men is 0.08 to 10.8 nanograms per milliliter. 18 and over is 0.01 to 2.47 nanograms per milliliter. And for women, it would be for ages 0 to 10, 0.12 to 7.79 nanograms per milliliter. 11 to 17 for women is 0.12 to 8.05 nanograms per milliliter. And finally, 18 and over for women is 0.13 to 9.99 nanograms per milliliter. So I was surprised looking at this information because the contrast between men and women are obviously different. Women have more growth hormone in their system, and I thought that was interesting. So I found out that it is actually correlated to the amount of estrogen in a woman's body. So typically when researchers were studying, they would find that women who were over age of when they were postmenopausal, they wouldn't produce as much growth hormone. And I just found that interesting. So for the disease state, when you have an excess, it can cause acromegaly or gigantism, which are essentially very similar. They affect people pretty much the same way. it usually typically results in a tumor. Initial symptoms are enlarged hands and feet. People with this disease often experience joint pain, headaches, deep voice, along with many other symptoms, but those are the most common. The picture on the right is of a pro wrestler with acromegaly, referred to as Andre the Giant, who died at 46 from congestive heart failure. And you'll notice that 46 is a very young age to die of congestive heart failure. So it actually has to do with his acromegaly as well. Let me just move my face out of the way. Okay. For the disease state for too little, a deficiency is caused by pituitary issues. It could be caused by brain injury, or it could be caused by genetics. Adults tend to have a different side effect as children. For adults, it seems a little more minor. It includes increased fat storage, weak heart, weak minor and bones. Weak muscles and bones. But it also included some like fatigue. It seemed like diagnosing an adult was a little more difficult because the symptoms are a little less severe. For a child, when they're deficient, it can cause a slower growth rate and sometimes pituitary dwarfism. We'll get into treatment later, but typically they think they're able to catch dwarfism in time so that they're able to treat it easier and that the child won't suffer from dwarfism unless they don't seek medical attention. Okay, so Adam Rayner I thought was an interesting character, so I thought I would add him into my little slideshow. He's actually the only person ever recorded in history to be considered both a dwarf and a giant. He was born in 1899 in Austria-Hungary, and at the age of 18, he was measured 4 feet and a quarter inch. He had a pituitary tumor that they later diagnosed once he had passed away, but it caused him to have a dramatic growth spurt in adulthood, and he died at age 51, and he died at 7 feet 8 inches. So he went from 4 feet to 7 feet. Okay, diagnosis. For diagnosis, it is a little more complicated than some other labs. So, typically if you suspect you're in excess or deficient of something, you can get a quick blood draw and it will, give you the score. You're either out of range or you're in range. But it works a little different for growth hormone because it is delivered in pulses. So typically what they do is they diagnose by a blood draw in conjunction to signs and symptoms, but the blood draw is done differently. They either do a growth hormone stimulation or a growth hormone depression. So the stimulation consists of fasting for 10 to 12 hours. Then you're given an IV solution that stimulates production of growth hormone. Blood samples are often taken at timed intervals to see if appropriate amount is being produced. For growth hormone depression, you must fast for 10 to 12 hours as well, but the patient is then given a glucose solution in which you drink instead of getting an IV solution. And then they take the blood draw at timed intervals and see if the appropriate amount is being suppressed. After a diagnosis of deficiency, a doctor typically will order an MRI to inspect the hypothalamus or the pituitary. For treatment. For treatment, deficiency is often treated with synthetic growth hormone to replace what is not being produced. This does require daily injections for several years, but the effects of the drug typically will start working in just a few months. For excess growth hormone, typically you're seeing an excess due to a tumor. So this is treated with surgery, radiation, and medication. Medications can vary from growth hormone antagonist, dopamine agonist, or somatostatin analogs. And that is my presentation on growth hormone. Here is my reference page. I hope you learned something new from it, and thank you very much.